And we're very excited to present this topic. I know there's a lot of information and misinformation in the media right now. It's becoming a billion or multi-billion dollar industry and a multi-billion microbial industry, and it's hard to make sense of it all. So I'd like to start with my husband, Chris Devereaux, who's a gastroenterologist, and then I will tie it all in with the lungs, and we have time for all of you for question and answers at the end. Take it away, Chris.
Good morning, all. I've opened with on the cover slide with one that I think is rather nice to see, but it does have a point. There is these are structures of DNA, and the idea when we're talking about the microbiome, there's a lot of discussion of the fact that the DNA of all the creatures living in our body outnumbers our own DNA by a significant order of magnitude. And that is at the heart of when people are saying that they must be affecting our body and our systems. And when we're talking about the things that live within us, they're the collection of bacteria, fungi, and viruses that live within us and in general do not do us harm. They are actually considered a component of our own immune system, and they profoundly impact the mechanisms of our own defense against other creatures by occupying spots in our body that some more pathogenic organism might take advantage of. And as such, it is important to understand that when somebody tells you you have a bacteria in a certain part of your body, it's important to discriminate between a bad bacteria and a good bacteria. And it was told to me very early in my training, and it stuck with me, that a lot of people view the human body as just a tripped out car for the bacteria that live in us. And they modify us to make their life better and to go where they want to go. When we talk about the microbial composition, it's known to directly influence the maturation of our immune response. And over our lifetime, its continued effectiveness. And as mentioned, it protects against pathogenic organisms having an opportunity to become established within our body. And the presence of good bacteria will actually balance our own body's response to organisms, which is what inflammation is, and our own homeostasis of our immune system.
And pathogen means that it's doing something bad to us.
Correct. So when we talk about protective strains, people should be aware there are bacteria and skin flora living on us all the time. And the disruption of them will actually lead to rashes and inflammation. If we remove the good skin flora by trying to be overly clean on our skin, we will actually cause more of a problem than just allowing our natural oil systems to have normal organisms to do their job. Same thing in the mouth. If we have normal good bacteria that create films that keep the pH level correct and suppress the bad ones that would lead to something like gingivitis. In the GI tract, there are studies that suggest the organisms living there will even sit in substances that will influence our nervous system, including the brain and other parts of our body. And not only are they, as I talked about before, adjusting our body to make their life better, and in the process helping us in many ways, they will serve the purpose of breaking down parts of our leftover food and getting us valuable vitamins and short fatty acids in the process. Now, this whole process begins at birth. And many people, whenever I talk about it, they start to think about, their children, grandchildren as well, because obviously we're well past that, but the next generation. But right at birth, processes occur that establish our immune system for our life. There's two general ideas right now that one of which is called the hygiene hypothesis, and argues that improved hygiene and lack of exposure to microorganisms of various types early in childhood will lead to a lack of a tolerance in our system, and later difficulty with environmental antigens and allergies. And we see that a lot. There's been several articles in the paper about the rise in more aggressive food allergies in people 20 to 30 years old, because when they were younger, they were not exposed to the food antigens to allow your body to become more tolerant of them at the right time. And there's other factors that if our food is too clean, we often have detergents and such that we're working so hard to clean that these get into our body and break down our protecting mucosal layer that's supposed to be there. And that allows antigens to come in contact with the skin of our intestine that shouldn't, and increase our reactivity to these allergens and other and bacteria. Now, the other idea beyond just hygiene is the new pathogen exposure hypothesis. This is a function of the global economy. People travel to foreign lands, yes, but our food comes to us from foreign lands. And this argues that the increase in what we're seeing, our reactivity, is not directly due to just exposure to certain things, but also exposure to things that are not typical for people who live in our area. So we're used to our own bacteria and our own neighbors and all the rest, but by going to other places, our body is forced to deal with a wider range of pathogens and things that can cause our body to become disrupted. And then you add in the stress of just modern society, travel and all the rest, and of course, smoking, things like that, that further reduce our mucosal barrier, which allows these antigens to come into contact with our system even greater and increase and magnify any reactivity.
So that's that leaky gut.
Well, it's a question. Leaky gut is, as a general term, the idea of in this situation, the mucosal barrier, it's just bringing it in contact with our immune system. Now, inflammation that results from it would lead to potential leaky gut, where the skin, when it becomes inflamed, its actual seals become looser, as opposed to removing the protective coating over it. So focusing in, though, right on dysbiosis, which is where we're sort of leading with the microbiome. That is when the actual balance of our organisms has become disrupted, and that then gets in the way of our natural system of how to keep our pH, our bowel function, and the things that it contribute to in its normal state. Classically, we think of antibiotics as the most common cause of that, especially when we're dealing with gastrointestinal issues. But as we were pointing out, disruption or dysbiosis can occur from other factors as well. Now, when specifically in my area, gastrointestinal illness, people hear most commonly about antibiotic-associated diarrhea, with the primary cause being Clostridium difficile. In that situation, antibiotics kill off the good bacteria, allowing a bad bacteria to establish itself in the GI tract. And then that leads to significant diarrhea and many hospitalization, and people can even die from that. Dysbiosis in our situation, though, where we're getting contact of allergens and bacteria that we don't like, can just contribute to chronic inflammation, though, and the development of things such as Crohn's disease and ulcerative colitis, where the body's immune system has been attacking the surface of the intestines and creating chronic inflammatory changes and damage. Now, that's a severe form, but there are those who would say it could be contributing to more just irritability of the bowel and irregularity of the bowel movements, whether slow or fast, and to the retention of gas and bloating, especially when the bacteria are eating food that we can't handle and they produce gas as their exhaust. Now, beyond my area of gastrointestinal illnesses, it's believed that this disruption of bacterial flora, as I was talking about, since these bacteria have production of substances that affect the body as a whole, can play a role in everything from obesity, and they talk about the shifting of a ratio of two GI bacteria, Prevotella to Bacteroides in this, diabetes, coronary artery disease. They talk about bacteria within the plaques within the arteries of our heart. Food allergies we touched upon, especially the rise in eosinophilic enteritis, which is essentially asthma of the GI tract. So that eosinophil is the same cell that contributes to asthma, which is next on our list. And we talk about skin conditions like atopic dermatitis. I've had many people who have had disrupted bacterial flora and have chronic inflammatory conditions, even psoriasis and other things, that by shifting their diet and using probiotics, they're amazed because all of a sudden their condition is significantly improved, if not resolved, and the treatment their dermatologist is using is all of a sudden much more effective. And we've long recognized that the balance of the bacterial flora of your GI tract directly affects the pH of not only the skin of your whole body, but specifically of other structures nearby, such as the female organs. And chronic vaginal vaginosis can be contributed to and caused to be recurrent due to a disruption in your bacterial balance. And finally, the most recent article was about the concern of the rise in colon cancer and a possible association with a dental plaque bacteria. And that is going to be an area of study for the future. Now, as we talked about, that the basic things are established at birth, and it helps us to understand that the mere process of being born in the traditional fashion exposes a child to a large colonization of bacteria from the mother. So obviously the mother's having good bacteria is very important for the baby to get established with good bacteria at birth. And it is felt to define the trajectory of the gut microbiome for the rest of your life. They know in that first critical time frame, breastfeeding in the first 6 months is felt to be good at establishing a healthy bacterial mixture within the human's system. And this has been a thing that has gone back and forth and harkens back to our other comment. There are no real studies supporting the delay of introduction to solid food in a child beyond 4 to 6 months. If there is not a significant risk in a family of an allergic reaction to a food, most are now moving to the idea that it's important to give the child a good exposure earlier in life to prevent later development of allergic reactions and inflammation of the GI tract and disrupted flora. Now, when we're talking about what we do. So we were born, we got through our life pretty well, and all of a sudden now things are disrupting. The main things are natural processes that we can incorporate in our life. And this is where the confusion comes in. There are multiple probiotics you can buy and diets you can do. One of the first things to point out, though, prebiotics are not probiotics. A prebiotic is where you're sort of gambling. You take food that you think will make good bacteria grow better, and you flood your system with it. Yeah, that's sort of might be a good idea, but they never really found a consistent response. Now, probiotics are the ones where you are actually introducing what we feel are healthier and better benign bacteria to occupy the areas in the intestine to keep the bad ones out. That one has a bit more support for it and does have suggestions of benefit. But whenever you do any of these changes, we have to take into consideration the cost, especially for these prebiotic and probiotics, and how long you're going to do it. Uh, Generally, they're low risk, but the cost and duration of what you're going to do, it takes a commitment. And now, when you're talking about diet, you may see remember some of these cartoons from before, but these are things I harp on quite a bit whenever I'm talking. Uh, to begin with, vegetarians will do better to a point. If you're a vegetarian with a little bit of like meat, you're going to actually be better balanced. Gastrointestinal specialists prefer balance. We hate extremes. Uh, the one reason I don't like people to go completely vegetarian, like vegan and extreme, is the high residue that those foods tend to occur. And so you have to be very careful with hydration. The more vegetable matter in your diet, the more hydration you need. Otherwise, you're going to potentially contribute to more gas and bloating from that vegetable matter in your intestines as it ferments. So if you are going to be a strict vegetarian vegan, you must be very good with hydration. Also, you have to understand that when you are relying on vegetable matter, you really need to cook a lot of it because that breaks it down and helps your body process it. Because the reason vegetable matter leads to gas and sometimes constipation when you don't have enough hydration is it stays there a long time. When it's cooked, it assists your body in the processing so it'll pass through in a more efficient manner. Uh, the other factor that is as we age, the inability to digest substances, classically lactose. If you feel that lactose is causing you gas, well, it's feeding the wrong bacteria. It is disrupting your biologic flora. Your best option is to avoid it. Now, avoiding milk in that situation is first, you reduce the lactose content. If that's enough, that's okay. But very often, it's better to just avoid that animal as the next step because different animals have different levels of lactose and different protein structures. And so your body may start to not like cow milk, and then you can go to an animal such as sheep, goat, or buffalo. Meyenberg Farms is a very common a company that sells goat milk in our area, which you can go on their website and find local areas. I get it at the Bonds, and it's found that many people who are intolerant of cow milk do better with that antigen and lactose structure. And when you're talking about a sheep or goat milk, that's equivalent essentially to A2 milk, the expensive cow milk that's been modified. I've come to the general position that when you tell me the word modified, I start to flinch. I would rather use a natural substitute than a modified substance due to various factors, again, of dysbiosis and potential forever chemicals involved in the process of that. And that's sort of why we're now starting to back away from oat milks and nut milks, trying to understand exactly the process they're going through to create this artificial substance to replace something. And we have to really start to think hard where we're getting the food, how they're making it, and how we're treating it. Coming down to that aspect, when we talk about fake sugars, more and more people are discovering that fake sugars confuse our body and our gut. Uh, and there's concerns that it may make your blood glucose harder to control. There's concerns that it will feed the wrong bacteria. And so judicious use of natural sugars is still probably the better option. Uh, and when you talk about any foods that you're using, how you cook it makes a difference. Cooking something in a plastic can, in a plastic tub, in a microwave, a very, very bad idea. Forever chemicals in plastics and in the coating on pots and pans is being called more and more into question. And article after article suggest that it's better to use cooking the food as we talked about, but cooking it in a container that is safer and less likely to introduce other elements into the food that might disrupt your bacterial flora and your system, in addition to potentially causing an increased risk in cancer. Now, the last point, though, is diet is a lifestyle. Life meaning you would get a diet that's good and you stay with that diet. And we're going to talk about fad dieting here. Fad dietings are extremely popular because they give you the sense I can achieve my goal and then, I'm good. That is not the way you should look at things. Fad diets, being by nature a short period of time endeavor, once you stop it, you're ending right back where you started. And any dietary change, it takes months for your bacteria to adjust, for one, and your weight to shift. But fluctuations in these things cause greater dysbiosis and dysmotility within your GI system, contributing to gallbladder malfunction, irritable bowel, and all the rest. People argue, well, I really like to fast. And the thing about fasting is some people do, swear by it, but you've got to realize that we don't really understand the mechanisms by which fasting causes the weight loss and its effects upon your health. And studies have shown that a year out, even that people who are doing intermittent fasting versus those who just do a caloric change really don't see any difference in weight loss. And when we're dealing with a system and we're dealing with adjustments in diet, long-term things, change introduces disruption. It is far better you maintain good hydration and a consistent exposure to a system, and then you will get a consistent crop. The crop here being your bacteria within your GI system, and develop a system that is more likely to be resilient and resist change.
What about the thought or rumor out there that keeping an empty stomach with fasting helps promote growth of your good bacteria?
That's not been proven. That's the trouble. There's a lot of things that sort of sound like that would be the case, and then it doesn't really show that. It and you've got to be defined what is truly empty. I really do not think the GI tract likes a truly empty system. And I always tell people, if you're fasting, you better be hydrating that whole time very aggressively to flush the system. And the argument about the fasting is that you starve everything. And that's what the empty is. You're starving the bad bacteria. And then the good ones have a chance to take over. I'm more of the camp that if you're not eating for an extended period of time, you should be taking the hose and washing the pipe. So drink the water, flush out everything that you're disrupting. And I would introduce the probiotics during those times and say, hey, I'm killing the bad ones. I'll send some hydration and some nice new healthy bacteria down there to fill the niches of the other ones that I'm killing. And that brings us to probiotics. Now, probiotics, there are so many on the market. They're extremely expensive in most situations. I picked these three because generally they're the ones I use. This is not an endorsement. I will explain why I use these, but again, argument can go on for hours. The reason being is different probiotics have different strengths. Different bodies like different strains. So somebody may take in a line and say, it's the best thing I've ever done. While another person will say, no way, dysbiosis. And they try the other person's, they say, nah, this doesn't work for me. Well, yeah, your body likes that particular strain. The one thing I tell people when they're looking at a probiotic, though, is since most of these are going to die, no matter what you use, you really want something that has a good bang for the buck. Billions of colonies as opposed to millions. And I've been more happy with the freeze-dried powders being when reconstituted they seem to me to get a greater delivery when I'm using these. I do find that use of probiotics help. I do find that they will prevent travelers' diarrhea. I've seen that they will help reduce gas. They will have beneficial effects on skin conditions and all the rest. But again, the studies are still out on all of these things. So it's a matter of deciding what works best for you and understanding these are technically medical food. And that's why they're very safe. You're eating something that your body uh, likes. Uh, and I do argue that even though the studies are not out there, is that people who are prone to dysbiosis should be on the probiotic while they're on something that would disrupt it. So if you're taking antibiotics, I tell people take the probiotic while on the antibiotics. While you're killing them, even though they say, well, the antibiotic is killing your probiotic, sure, it may. But the whole idea is you're flooding the system with good ones that will try to fill the niche as you're destroying all the flora. And then I tell people who are prone to trouble to take their probiotic for a full month after you finish the antibiotics. As the system is repopulating, you want to give advantages to the ones you feel help. Now, this same idea is the same reason why probiotics before you go overseas, as we were talking about exposure to foreign antigens. You start the probiotic a week before you go, you take it every day while you're there, not waiting for the symptoms, and then for a few weeks when you come back. You're thereby giving an advantage to the natural bacteria of your system to stay in control when exposed to a stressful situation, a travel situation, and across the board. Now, when things get completely out of control, there is fecal mycobacterial transplant. This is a stool reintroduction. This is not something we do lightly. It's effective, but it's not without risk. It requires procedures and such, and you go on to the next. So in this situation, classically for gastroenterologists, we do this in people who have a C. difficile infection or antibiotic-associated diarrhea and inflammation of the bowel. And if they've failed multiple antibiotics and they've been on it, we get healthy stool, we process it, and then we introduce it into the GI tract and rebalance their system, essentially dropping it right in the area and repopulating the environment with good, healthy, non-pathogenic, non-disease-causing organisms. And this is extremely effective at stopping C. diff in our situation. And in other situations where the microbiome is considered out of control, they are experimenting with this. But again, it's something that is an extreme. It's not something done routinely. Usually we go through a long process in gastrointestinal areas before we go to this. But in the future, there's going to be more of this undertaken. You can go on to the next slide. And so literally this is when we do reintroduction, this is it. We take stool, and when we're in the colonoscopy, we go over to the right colon and we squirt it right back on in. It seems gross, but it is very effective. Now there are movements where they would put this in capsules, and people would potentially swallow capsules of this, gross as it sounds, to repopulate their flora, and that is an extreme form of a probiotic.
Is there a question?
Now I'm going to obviously turn it over to Asha to continue on with specifics of microbiome to the pulmonary system, but I'll be available for questions at the end with her.
Well, thanks, Chris. That was very enlightening. And I think some of the things you've alluded to, I'm going to expand on in my section for all of you. And then Chris will come back to for question and answers. So as was mentioned, we start forming our microbiome at birth. And we have good bacteria and we have bacteria or conditions that lead to what's called dysbiosis. Now, in the pulmonary system, we get our bacteria from the stomach in some ways and from the air. Where our oral cavity and sinuses are a high biomass area, high concentrations of different bacteria. And the lungs have a lower concentration of bacteria. And we have this natural flushing mechanism called the ciliary escalator and mucus that will help keep our lungs healthy and immune and free from infection. So if we look at some of the bacteria in the teeth, we've got strep, actinomyces, that Prevotella that was mentioned, Neisseria. And if you've got too much of that, you get cavities and abscesses. And in the periodontal area, which is the gums, you get there's a bacteria, P. gingivalis, which causes gingivitis. There's strep and some of the other same organisms. And then in the sinuses and the nasal cavity, we have staph, strep, Moraxella, Corynebacterium, and they lead to recurrent abnormalities or air cavities or sinus infections. It makes us more susceptible to irritants and pollutants, causes an immune deficiency, recurrent viral infections, cystic fibrosis is a secondary phenomenon where if people have CF and that gene, what they are breathing in can cause significant disease. And then we have in our oral pharynx, which is kind of the back of the throat area, different bacteria come in, Bacteroides and Fusobacterium, which is something that has been just last week, Scientific American kind of has implicated that as being found in the middle of some colon cancers. So you're hearing kind of why all of this is kind of playing out. And then here's the esophagus. This was published in Nature last year, so that's why the spelling is more European. Um, and then in our airway, we still will see some of the bacteria, and then that leads to bronchitis. And in the esophagus, we see other bacteria that can get stuck and lead to dysmotility. And so when we talk about um, the lung, the pulmonary GI microbiome, they're interrelated. And when I ask you questions in terms of what color is the phlegm, what part of your body is this mucus coming from, I have an idea of what could be growing based on some of the characteristics in locations that you provide me. And then we can target treatment if you're having pain or fever or symptoms. So that's the dysbiosis, when these bacteria outgrow it and cause infection. So the lung microbiome in its normal state is dynamic. It shifts from little bit of bacteria to resilient biomass. It begins in the first few weeks of birth as the baby is transiting the vaginal canal and picking up the bacteria that mom had sitting there in the canal. And you get staph from the skin and ureaplasma from the vaginal flora. As the child grows, this microbiome diversifies and it helps in development of pulmonary immunity. That Prevotella, if it, and Veillonella species, if it prevails, is the child grows and it doesn't get replaced by other bacteria, we are seeing that maybe there's a subsequent development of reactive airways disease such as asthma. So how that bacteria persists and doesn't get taken over by other good bacteria then can lead to disease. Persistent aspiration from the mouth can lead to disease and inflammation. So if you don't have good oral hygiene, you can get pneumonia and recurrent disease. So here's kind of a picture of a lot of what Chris had talked about earlier. And this is for just in a sample of one air sac. Eubiosis means that we have balanced bacteria and we get some residual microbial DNA. This is our immune system. We have some macrophages, I call them Pac-Men. We have neutrophils, which usually aren't present. But if you aspirate, which means that, say you have a runny nose and congestion, and then you sniff because you didn't blow your nose, you inhaled that infection into your lungs and a little drop got into your air sac, then here you see some of the oral fragments from our mouth. And then you see some white cell neutrophils kind of starting to form, trying to kill these bacteria. And that's okay. That's actually what's normally supposed to happen. However, if, and so this is all normal, this is our normal clearance. Now, if you're balanced, these cells are all produced from, we all recurrently aspirate a little bit. And then you've got your immune system that helps kind of develop and get a memory. So during this clearing process, then we develop some memory. And our lungs are a huge immune organ. So we do have lung immunity and lung memory. However, if we keep aspirating, if we keep challenging our lungs and keep giving it more unhealthy bacteria, then this inflammation persists. And then we get reactive oxygen species. We even get a biofilm formation. We see this a lot in our smokers or former smokers because they've kind of killed this ciliary escalator. And so they can't funnel and just recycle the bad bacteria out. Also, vaping or smoke inhalation or anything that can clog up our alveolar or air sacs leads to this and can lead to immune exhaustion. So the diseases that we can find that we know are associated with some dysbiosis is COPD, which, as I mentioned, is a tobacco-related issue. And we can see that sometimes we have what we call chronic colonization, where we know somebody's spitting up a regular discolored phlegm every morning and it will have bacteria in it from the night. And that's kind of part of the normal, we have to help it with pulmonary clearance. But at some point, it can then get pathogenic where wheezing, fever, other symptoms develop, and that's when we have to treat it. As the severity of COPD increases, either the bacteria helped it get worse or the aging process did. We also know in pulmonary fibrosis that aspiration of your GI contents can lead to lung fibrosis. And that's why we try to have a healthy gut in our chronic lung disease patients. Asthma has been definitely linked with the dysbiosis of the lung, as Chris also mentioned. It kind of triggers an allergic reaction. ARDS is been implicated. So when a person gets put on a ventilator, whatever was sitting in our mouth pools and then collects around that tube and can slide down into the airways. So now in the intensive care unit, good oral hygiene is something that helps prevent what we call ventilator-associated pneumonia. Now, interestingly, lung cancer, there are some lab studies that are showing that in some lung cancers, if you had dysbiosis with this organism, the Veillonella, which I mentioned is also implicated in asthma, it can mutate the DNA and lead to some cancer progression. Now, this is lab studies. And then if you have established cancer and get a bacterial infection, you may actually propagate that cancer or make it develop into a later stage. But we also have some bacteria that we inhale may have a regulatory function in our system and kind of serve as a check and balance. So there's a lot to learn here. This is a theory of kind of the check and balance of our system. Here is kind of a rendering of how that would look like in how dysbiotic events kind of make us susceptible to injury and how we can have um, some type of feedback system where we can kind of kill our bad bacteria on our own. Now, Chris alluded to forever chemicals. And I wanted to spend some time talking about that because you're kind of like, how did that happen? I mean, 40 years ago, nobody ever heard of I I mean, I remember laughing 20 years ago when probiotics came out. And I'm like, oh my God, what have we become where we have to give antibiotics and then now feed people regular bacteria that's ubiquitous? We never even had seen that even in medical school. We never saw the number of GI symptoms that we had and thyroid disorder. It was becoming about 20 years ago. I was like, what's going on? Everybody's thyroid was abnormal. Well, there's something that now, just now, is hitting our media, the forever chemicals, but something that I've known about since the early 2000s. And what that is the PFAS or per perfluoroalkyl substances or polyfluoroalkyl substances. And now we see that it's been linked to cancers, impacts our liver, our heart, our immune system, creates developmental damage to infants and children. The EPA is going on high alert, informing the public. The examples of this are triclosan and triclocarban. Those both have been banned, and I'll show you the slides to that. But these two chemicals came out in the 90s in the antibacterial soaps that were very, very promoted. And in other substances as well. We can see some forever chemicals, definitely in pesticides, but stain resistance products. So think carpet coatings. We know that firefighting foams have a multitude of different toxic substances that then enter into our water streams. Microwave popcorn in the bags have these substances. I hope people aren't using microwaves anyway. We got rid of our microwave oven, but the popcorn also has a microwave popcorn lung disease just from inhaling the toxic substances that come out when you open your bag. So, and that can create a lung disease in and of itself. Makeups, the coatings on pizza boxes, paint, sealants. You know, when you get a choice to paint your home or your interior, choose the organic paints. Cleaning products. 20 years ago, because of the literature that was coming out on the PFAS, I switched and on the literature on cleaning products and links to asthma and allergies because of the chemicals in them. We switched our cleaning products to organic. Also vinegar, you can get that 2 big gallons at Costco for like $3, and dilute that with water and clean your granite with that. Nail polish, dental floss, non-stick cookware, the Teflon can leach and create these forever chemicals. Now, all these substances do not degrade and get put into our water system, into our vegetables, into our grass, and it then comes back to haunt us more. Non-stick cookware now, because of the ban on so many of these substances, you will see on the labels that it is safe. And there are now much more attention to detail on that. But water resistant clothing, or if you spray on it, my latest thing is trying to replace that bounce or those dryer sheets, because that actually coats our clothing repetitively with a substance that can be harmful to us. Look at your shampoos. and look at the ingredients in them. I try to promote everybody to use organic shampoo products and organic soaps as well. Candy wrappers, well, you know how I feel about candy, so we can skip that. But we shouldn't be, just look at how everything is packaged and processed, just like Chris said. And it's because of all of these things entering into our body. Triclosan, triclocarban are antibacterial, but that's antibacterial to our good bacteria in our system. And I think that since the introduction of these chemicals into our overall biome, we are now developing dysbiosis. And that's why we're having to eat other bacteria just to offset this. Here is a couple of here's just a couple of literature showing triclosan exposure and allergies in Norway. This is 2012. The impact of early life antimicrobials on asthma and eczema risk. And they said currently we don't know what lifelong changes can be, but we do know that these substances, the parabens and triclosan, alters the immune function and microbiome diversity and increases the risk of allergic diseases in childhood. Just recently, and I'm sure you're seeing in the headlines, our young people are getting different diseases and cancers early. Maybe now we can attribute it to this 1990s exposure to everything being kind of purified in antibacterial soaps. The FDA, because of the data just on the allergies and immune system, it took a lot of lobbying and efforts, but the FDA banned these two substances, triclosan and tricloban, in 2016 and said they have not proven any difference in antibacterial effect than soap, regular soap and water. And so they used that rationale that we don't know what the long-term damage will be, but it's no different than regular soap and water. And because of that potential risk on hormone disruption and immunity and maybe thyroid dysfunction, they banned these two substances, but other substances are still present, like benzalkylonium chloride. And this is just yesterday, as I was preparing the slide presentation, Dial is still selling antibacterial cleansers. If you look at the toxicity of benzalkylonium chloride and other triethylene glycol, which are these two substances that are now providing antibacterial effect, we know that they are in household products and it is highly toxic. It is not banned. So what does a person do with this information? Well, there's the environmental working group that has actually a website where they grade your cleaning products and other substances on its safety in terms of all these other aspects, chemicals. And so I invite you to check it out. But try when you're at the store to look at the ingredients, make sure you can understand the terms, look them up and be discriminating. I actually don't even like the plastic that we are storing all our products in and our foods, and I'm trying to get away from all of that. Buying things that are in glass and then using my leftover pasta jar that's washed to store other leftovers or something, just to keep it in glass. If I get some of my favorite lotions and it came in a plastic container, I quickly transfer it into a glass jar. These are things that I've evolved to. There's still always room for improvement, but if you're 90% trying to be clean and healthy, then if you do get an infection or cancer or something, at least you know you've done everything you can to give yourself some immune boost. Now, microbes are being investigated. So not all bacteria is bad. They're actually looking at creating some microbes that can take the forever out of these forever chemicals. So it's not, we're not losing hope. They're looking at ways to put something onto the firefighter foams or something that will then allow it to degrade into our water supply and system. But it has to be done safely. Because remember, right now, these forever chemicals are also affecting our fish population out to sea. So the whole ecosystem gets involved by these forever chemicals. And here is the concluding slide in terms of the balance of microbial immigration and elimination for our bodies, how we want to try to balance it. If we've got it more on one side than the other, we will get dysbiosis and disease. Factors that help with eubiosis or a happy, healthy medium is breastfeeding, vaginal delivery, healthy diet, exercise to help our immune system. And then formula feeding, antibiotics, an unhealthy diet, heavy weight, kind of lean that seesaw in the other direction. Just know that our diversity of our microbiome accelerates to midlife, and then it decreases as we age because we can't handle as much. But we also see with that is some immune resilience as well. So with that, I'd like to conclude and bring Chris back for questions. And I'm going to pause the recording.